being evacuated. And the study looked at what score essentially is in the room after just 6 seconds of using a Bovie. So to give you guys kind of a visual of this, you can't see this that well in the back, I'm sorry, but this is what's going on after 6 seconds. So this is on, and it's cutting. You guys see the smoke, kind of? Okay, so 6 seconds of Bovie smoke being generated. This is a banana too, so it's not as harmful as cutting on a human. What would you guys guess the score is after just 6 seconds of using a Bovie?
Yep, yellow.
Yellow is 51 to 100. 200 is the red. Any other guesses? Purple. Okay, hobbling back over here now. So after 6 seconds of using a Bovie in an operating room, the air quality score gets up to the maroon, which stands for hazardous. And the description here is health warning of emergency conditions. Everyone is more likely to be affected. So again, that's just under 10 seconds, but for you guys, it begs the question, a case doesn't last 10 seconds. Sometimes cases last for hours on end, and you're in an operating room, for weeks, months, years at a time. So what does this mean for people who are working in these conditions, and what has the state of Michigan decided to do to take some action on this, more importantly? So this is kind of some of the topics we're going to try to hit on, but the main thing that we're going to talk about is what's going on in the state of Michigan. So last time I was here, I showed you a map like this. Does anyone remember that? So when I was here last time, there were about 20 states that had some kind of legislation and or pending legislation. So if you're looking at this map, yellow indicates that you have pending legislation in that state. If it's kind of like a darker green color, that means that there's already legislation enacted. What is different about this time is there's now 30 states that have some kind of pending legislation. And now Michigan is one of them. So what does that mean for you guys who work in the operating room, and why did they ultimately decide to do this? And again, to go from about 20 to 30 states within a year period of time is a lot. All this has happened since 2018. So in 2018, the first state went smoke-free, which was Rhode Island. And between then and now, so about 7 years, we have 30 states that have enacted some kind of legislation or are in the process of putting in legislation. So this is literally the bill in the state of Michigan. I'll read it out loud because it's a little difficult to see in the back. This was introduced in June of 2025, so just a handful of months ago. The people of the state of Michigan enact a health facility or agency that provides a surgical procedure using heat-producing equipment that is likely to generate surgical smoke plume shall develop and implement a policy that requires the use of a surgical smoke plume evacuation system during a procedure described in this subsection. Surgical procedure using heat-producing equipment means any of the following. A procedure that uses an electrical current to cut, remove, or destroy tissue and control bleeding. A procedure using a laser. Any other procedure that uses a heat-generating surgical instrument. And it literally defines what surgical smoke plume is. It means that's a vapor, a gas, or any harmful particle produced as a byproduct of a surgical procedure that uses heat-producing equipment. And then also looks at what is a surgical smoke plume evacuation system. That is a dedicated device that is designed to capture, transport, filter, and neutralize surgical smoke plume at the site of origin and before surgical smoke plume can make ocular contact or contact with the respiratory tract of an individual. Okay, so you need to have your device within a certain proximity to be able to adequately capture all the smoke that's being generated. So this bill was introduced, kind of begs the question, well, what does that mean for you guys? Funny enough, we had this scheduled for about a month ago, but it sounds like you guys needed to do a fire drill. Hopefully it wasn't like the one from the office where they trapped you in the room and heated up all the door handles. I don't know if you guys.
Oh, that would have been better.
Yeah.
Thanks for the idea.
Yeah. Yeah. So, where are we at in the process? Does anyone remember that video from school where there's that animated Bill talking about how he's just a Bill?
Yeah.
That's what's going on right now, okay? If you want to get a little nostalgic about it, I'm not going to sing it.
I'm just a bit.
There you go. So this was introduced June 25th of this year, and just last week, this was voted on by a House. A committee was formed to take a look at this. A committee unanimously voted to approve this. The House voted to unanimously approve this, and actually next week, the Michigan Senate is going to be voting on this. They are not shut down. They're going to be voting on this to determine if this is going to pass to officially become enacted legislation. What I'll say about this is I've never seen an instance yet where a bill is introduced in a state along the lines of surgical smoke plume and it doesn't pass, because the literature and the evidence is really overwhelming about how harmful this is for the people in the room who are exposed to this stuff. So that's where we're at. And as we learn how next week goes, I'm sure I'll let Chantal and Lisa know what's going on, but that's where things stand right now. And then for the rest of the time, I figured we could just do a little refresher on what some of the recent literature is. So what exactly is inside of surgical smoke that is making 30 states enact a law saying you need to get rid of this stuff? Maybe you recognize this slide, but essentially this is everything that's inside of, not everything, but these are some of the things that's inside of surgical smoke. You have particles, cells, gas, blood, viruses, bacteria, and if you think about it, you're using what we just learned, heat generating device that's cutting open the human body. And so all these things are a part of the human body, and there's so much energy going through a bovie or a laser that essentially anything it touches evaporates it and it becomes a part of the air. Now, a thing to call out for you guys in the room, 3 of the most common heat generating devices is a electrosurgical unit, which is just a fancy word for a bovie, and a laser, and an ultrasonic scalpel, used very rarely. About 85% of the time when a heat generating device is used, it's usually a bovie. And so something to call out for you guys to remember from whether you're using a bovie, a laser, or the scalpel is a bovie generates the smallest kinds of smoke particles. Anyone know the term micrometers, or do you remember me talking about that last time? So micrometers is essentially just a unit of measurement. Something for you guys to remember is anything under 5 micrometers is considered to be lung damaging dust. So if you're exposed to something that has 5 micrometers or under, you're breathing in stuff that can not only go into your mouth, nose, and throat, but it's so small that it will travel down into your respiratory tract and into your lungs. I believe most N95 masks are rated to filter out stuff 5 micrometers and above too. So even though you're wearing something that is definitely better than a surgical mask, that stuff is so small, it's getting in between those things. And if I'm not going to do this because I don't want to lose my hair, but if I pulled out a piece of my hair, surgical smoke is over 100 times thinner than a single hair follicle. So when you're using a bovie or a laser to generate smoke, that's how small that stuff is that's getting through the PPE that you are wearing. And so clearly states are now recognizing this stuff and going, oh, we need to take action to prevent our healthcare workers from being exposed to this stuff. There's dozens and dozens of studies that show that chemicals like this exist inside of surgical smoke. So one call out here is there's over 150 different chemicals found inside of surgical smoke, and 16 of those chemicals are on the EPA priority pollutants list. So this list essentially says, if you're ever exposed to these things, it's very bad for you, but we have clear literature that shows these things are inside of surgical smoke and healthcare workers are exposed to it if the smoke is not evacuated out of the room. I'm gonna skip over this slide right here and kind of go on to the next one due to time. But there was another study that looked at plastics cases in particular. So plastics cases are one of the specialties that bovie the most. You know, if you're doing especially something like a double mastectomy, where you sometimes have, you know, more than one surgeon bovieing for 75, 80% of the case, that's a lot of bovie smoke that's being generated. Not all specialties obviously bovie that much, but that's one that bovies the most. And they looked at, is there any kind of correlation between people in the room being exposed to the smoke in plastics cases compared to being exposed to just cigarette smoke. And they found there was a pretty sizable correlation between being in plastics cases for 8 hours at a time as compared to being exposed to just even secondhand cigarette smoke. Maybe you remember this, but does anyone have a guess as opposed to what they found in that study? So they found that being in plastics cases was the equivalent of smoking about X amount of cigarettes in a day. Say that again? 6 packs? How many are in a pack? 20?
20? No.
You are huffing and puffing if you're doing that many packs a day.
That's all you could do. Just sit there like one off the other.
Yeah, for real. So they found that it's about the equivalent of 27 unfiltered cigarettes. I like rounding up to 6 though. Kind of depends on what's going on. But yeah, that's almost a pack and a half a day. So that's a lot, obviously. No one who smokes would say that they think they're doing anything good for themselves, even if someone's in here and they smoke. I often hear people who do smoke, usually before they go outside. Well, I mean, now there's just, you know, the vapes, pens, I can't keep up with all of it. But people who go outside to smoke, I usually often hear say something like, oh, I'm gonna go kill myself, or, you know, I'm gonna smoke and I'm gonna shorten my life a little bit. So no one would argue basically what I'm trying to say, that smoking cigarettes is good for you. But there's been this clear disconnect between making laws around smoking indoors compared to being exposed to surgical smoke in an operating room. Because quick history on surgical smoke, I'm going to skip the slide again. It's been decades that we haven't been allowed to smoke indoors, but it's just now becoming a thing that we're not allowed to operate without using smoke evacuation systems so that you guys aren't exposed to those things. So in the 80s is actually when it became illegal to smoke on airplanes. Funny enough, in the early 90s, the Joint Commission made it a rule that if you wanted to be accredited by them, you needed to have a smoke-free policy in place. Just back then, it didn't also translate to the operating room. It just was pertaining to cigarettes. And then there's been a lot of, pretty much every law, or every state has a law about not smoking indoors anymore. Every major third-party organization that has anything to do with hospital guidance, guidelines, policies has usually something to say on surgical smoke evacuation. For sake of time, I'm not going to go through all of these, but OSHA acknowledges that smoke evacuation systems should be used. The Joint Commission does as well. This is a clip from or a quote from OSHA's website that says employers should have smoke evacuation systems that should be used at all times when smoke is generated. This is from the Joint Commission right here. And I know whenever the Joint Commission comes around, everyone's like, oh, Joint Commission's here, you know. I've been at hospitals, coincidentally, when the Joint Commission is there. It's never fun, but I have heard them start to comment and call out when they smell smoke. I go to Ohio sometimes, and I was there when the Joint Commission was there, and it was a hospital that was not smoke-free yet, but the law had just passed. saying that hospitals need to furnish smoke evacuation systems to evacuate the smoke. And they weren't using it, and you could clearly smell the smoke in the hallway. You know, it goes out from the door cracks. If you're walking by the desk, you can smell it. And so they called out to the nurse leadership. They're like, you guys don't use smoke evacuation. And so as soon as the Joint Commission guy left, they're like, when can we go smoke free? So people are starting to call this stuff out now, and especially when it comes to the law, the question is, what does this actually look like? So if the state of Michigan enacts a law that says you guys need to use this stuff, how do they actually monitor or track that? Well, from what we've seen, usually the state health departments get additional funding to conduct more audits to make sure that people are doing this. And so it's not really a matter of, you know, you can't just use it and then on the off day decide to use it when they're there. Because in all the states where this is actually a law, the consequences of not using it usually result in thousands of dollars of fines, and it's usually per infraction. So if you think about per infraction, that's, you know, per case. If you're not using a smoke evacuation system, doctors, I don't know exactly how it will work in Michigan, can be subject to fines and losing certain accreditations. Again, for sake of time, kind of going quicker through some of this stuff, AORN has a Go Clear award that they've had this for years. They're super passionate about making sure that hospitals, nurses specifically, aren't exposed to surgical smoke. Few quick case studies that should no longer need to happen when this law goes into effect, but two quick examples of kind of some of the consequences of being exposed to surgical smoke long term. Maybe you remember this, I did share this example last time, but this guy is Dr. Anthony Headley. He was a total joint orthopedic surgeon. He worked in the operating room for over 3 decades, never used smoke evacuation once. Long story short, at the end of his career, was diagnosed with idiopathic pulmonary fibrosis and needed a double lung transplant to get that treated. And he's not a smoker, and he essentially did the math and figured out the only time he's ever been exposed to smoke was when he was in the operating room and he was breathing that stuff in. Total joints is a specialty where they also do a lot more Bovium than others. So he was diagnosed with that, had to do a double lung transplant to get that treated. This is probably one of America's most famous nurses. Anyone ever heard of this woman before? Julie Greenhall?
Mm-hmm.
Okay. So Rhode Island was the first state to enact legislation on surgical smoke evacuation. And she was a nurse in Rhode Island. That's a picture of her testifying in front of state representatives. Fun fact, when this law was introduced in Michigan, when this law was introduced in Michigan, there were several nurses that when they found out about it, voluntarily on their off day went to Michigan Capitol to testify and share their experience with surgical smoke. And this is her doing the same thing back in 2018. So she's sharing what it was like for her to be an operating room nurse for over 40 years, because she said after 40 years of doing that, her lungs just couldn't take it anymore and pivoted to an office job. The analogy that she used was it was kind of like you're sitting at a bonfire, and the second you sit down, the smoke starts coming at your face, and then you pick up your chair and you move to the other side, and the second you sit your chair down, the smoke starts blowing that way again. Anyone ever experienced that before? So that's what she said it was like trying to get away from surgical smoke in the operating room. But she helped champion some of the first legislation in the country. And then just a few quick hitters before we go, because this is all stuff that the House, Senate has looked at in terms of why we need to enact this stuff. Nurses and scrub techs report over twice as many respiratory problems compared to the general public. This is a study that was done analyzing, people who don't work in operating rooms compared to people who do. And the pink graphic is people who work in the operating room. The one to the right of that is people who don't work in the operating room, and they looked at stuff like allergy, sinus infections, asthma, bronchitis. People who work in the operating room, they saw that twice as much compared to people who don't work in the operating room. Some other stuff that's led to some of this legislation is another study done by Boston University shows that people who work in the operating room for 15 years or more without smoke evacuation are up to 46 to 70% more likely to develop chronic obstructive pulmonary disease. So not good stuff, obviously. One quick thing I want to comment on, because we talked about smoke evacuation systems in the law. This is a picture of your Neptunes, okay? This has basically the hood popped off. You can picture that. So a Neptune is awesome because you're never exposed to fluid, but the fluid is trapped in these internal canisters, okay? So what I want to call out is the canisters are not smoke evacuation systems. Sometimes I've seen people a little maybe confused. I've seen maybe, especially surgeons go, why do I need to suck the smoke into the specific filter when my fluid suction or my sucker is suctioning up the smoke? Have you guys ever heard that before? But essentially, if we see the fluid suction line, if that is sucking up the smoke, it's just going inside of these two internal canisters. It's not actually getting filtered out. And we've learned about how small surgical smoke is, and because it's so small, it essentially just gets back out of the canister and is still in the room. So even though you have the illusion that the smoke is getting sucked up by a form of suction, it's actually not getting filtered out. You need a specific filter that traps the chemicals inside of surgical smoke and then goes through this filtration process to absorb the chemicals. And that's where this thing on the side of the Neptune called an ULPA filter comes into play. So the ULPA filter is a triple filter system that captures the chemicals, and then it has charcoal inside of it, and that charcoal actually absorbs the chemicals so that the air doesn't have that stuff in it anymore, as opposed to if it's sucked up in this thing, nothing's really happening to it. So for you guys going forward, one thing for you to know is make sure that as much as possible, the smoke is getting captured inside of that ULPA filter on the side of the Neptune. You have a question back there?
Is there the air that's coming out of the Neptune?
The
Is there
air?
no filter? There's gotta be air. If air's going in, air's gotta be coming out. There's no filter with that air, because you don't smell the smoke once it goes into the Neptune. So where, is there no filter leaving the Neptune? There's gotta be air coming out of the Neptune.
So a Neptune is just essentially a powerful vacuum. So when smoke, yeah, so there are two different filters on a Neptune. So one of them is the ULPA filter, and then if you can picture where the ULPA filter goes on the side underneath that, it's like a door that you can open up. We switch those filters out. That's a filter for the actual fluid suction, but it's like a vacuum, but there isn't also like a port where like air is escaping out, if that makes sense. So you have a smoke filter and a fluid filter. If smoke travels through the tubing connected to the smoke filter, it gets sucked up and it's gone. But if air sucks up through the fluid tubing, it can escape back out of those canisters. But there isn't like a exhaust port, if that's what you're asking, like a vacuum that air continuously goes out of. Okay, any other questions before we wrap up? Yeah.
So is there a machine that is recommended to evacuate the smoke?
So the question was, is there a machine recommended to evacuate the smoke? So the good thing about your hospital is you already have smoke evacuation systems on the Neptune. I'll go through a few quick slides here. So you guys all familiar with how to turn on smoke evacuation on the Neptune? That is what your recommended device would be. This is just a screenshot of the dashboard on the Neptune when you turn it on. You'll notice that in the top right corner is the evacuate smoke button. You press that button and you turn smoke evacuation on or on auto. I personally would recommend, especially in cases like plastics, total joints, to get the best smoke evacuation, it is probably recommended that you have that on as opposed to auto. The reason why is because the auto on the Neptune will kick on once it detects the smoke. So it doesn't kick on the second the surgeon presses the actual Bovie button. So there's usually about a second or two delay until the Neptune will kick on if it's on auto. And if the doctor's like picking up the Bovie, doing a few at a time, putting it down, and kind of doing one of those things, very possible some of the smoke will escape, but if you have it on, it should capture it. And then I would recommend that you have it on at least 70%. When you turn smoke evacuation on, it will default at 40%, and so you have to manually adjust it with these arrows right here. I'd recommend having it at least at 70%, but if you're smelling any smoke, adjust it, turn it up, change it from auto to on. So to answer your question, you should be using the Neptune for smoke evacuation. There are like compact smoke evacuators, like that white box